the fight against Ebola has reached epidemic proportions. It has become an international health emergency with tensions running high. With no cure yet licensed, what does Ebola mean for West African countries? How and why did the Ebola outbreak spread? And what has been the response from the African and international community? Has it been sufficient? This report looks into the story of the worst Ebola outbreak on record. My name is Adama Munu, a journalist of Sierra Leonean descent. Born in Britain, I've always loved African culture and history, and fortunately for me, my family always educated me about my heritage. I'm here at Brixton Market, which is the heart of the African and Caribbean community in London, and I used to grow up here as a child, and it was one of my first experiences of African culture. In many ways, this market resembles markets in African urban areas. Bustling, lively and exciting, exploding with colours and flavours of different types and vibrancy. What was once a bustling area of the world has now fundamentally changed because of the Ebola virus which struck West Africa early this year. The first reports of the Ebola virus was confirmed on the 22nd of March 2014 in the Guéckédou forests of Guinea. The Guéckédou forests border Liberia and Sierra Leone, allowing for the free-flowing movement of peoples. It spread to Conakry, the capital of Guinea, within days, eventually making its mark in neighbouring Liberia on the 30th of March with 2 cases. The first few cases were reported in Sierra Leone on the 25th of May. These countries on the western coast of Africa then became the front line of the disease. Much of the spotlight has been on Sierra Leone, a country covering 72,000 square kilometres with a population of 6 million people. In 2001 and 2002, the UNDP Human Indexes ranked Sierra Leone as the least developed country in the world, having been devastated by civil war during the 90s. The Ebola crisis became its latest catastrophe when on May 26th, the World Health Organization declared the first Ebola death, and then it later spread on June 17th to Monrovia, the capital of Liberia, where it led to 350 reported death cases. The Ebola virus was first discovered in 1976, after it broke out near the Ebola River in Zaire, now known as the Democratic Republic of Congo, claiming 280 lives out of the 316 reported to be infected. That year, simultaneous outbreaks in Sudan claimed 284 lives, and the disease has been found since in other countries, such as Gabon and Uganda. The last epidemic of Ebola was in 2012 in Uganda. I wanted to find out about Ebola from a specialist on the subject of health epidemics, so I went to speak with Uthman Dar, a Public Health England official working at Chatham House in London.
The virus is what we call a single-stranded RNA virus, which is a precursor molecule to the building blocks of life, which are proteins. Now, Ebola is, of course, conjures up these images of rapid spread and fear and death, because it's one of the viruses that are known as hemorrhagic fever viruses. So because of the symptoms that can result from an infection, normally the infection appears between 2 to 21 days after you first get infected. And it starts off with a flu-like illness. So fever, muscle ache, which then progresses to symptoms like vomiting and diarrhea. The virus was discovered in 1976, and there hasn't been any effective proven treatments for it between that time and now.
In the absence of a cure, doctors can only hydrate their patients due to the loss of blood. Here, a boy struggles with breathing, with little relief. Not long after he dies, his body is taken away by medical staff and quickly dumped into a hole prepared for him, like thousands before him. Medical professionals also battled infection, the first of them being a native African doctor. Dr. Omar Khan was a Sierra Leonean virologist who died from Ebola in late July, a month after Sierra Leone's first Ebola case. He was hailed a national hero, having treated over 100 victims. Before his death, he explained why he thought the disease had spread.
By the time you have one contracting the disease, people going to take care of a dead. Avoiding, hiding, taking care of that dead. Don't forget, by the time people are dead with the Ebola, they are more infectious than all.
The distrust of authorities that Dr. S. Khan spoke about and attachment to traditional burial ceremonies proved crucial in the spread of the virus, as it meant that there was uncontrolled exposure to the infected and the dead. This distrust led to violence and anxiety in some communities. In the early months of the outbreak, there was much denial on the reality of Ebola amongst the masses, particularly in Guinea. On April 4th, there were reported mob attacks on an Ebola treatment centre in southeastern Guinea. Linked to the denial of the Ebola virus altogether was anger from some communities in Liberia towards the burial of dead Ebola victims in their communities, which were yet to be affected by Ebola. I met up with Andre Heller Pereche, the head of the programmes unit at Doctors Without Borders in London. They were one of the first charities to help with treating victims. He told me some of the main challenges the organisation faced and is still facing.
There have not been an adequate number of other either NGOs, non-governmental organizations, or governments to be able to respond to the crisis in terms of actually treating cases. The single largest challenge is that there is not enough help coming in the form of medical practitioners and individuals who can run isolation and treatment facilities on the ground to isolate and treat cases.
He also explained why he felt the disease had not been contained quickly enough.
The spread of it has been because there has not been enough treatment centers for people to receive treatment for the condition, as well as to isolate them from being able to further transmit the disease. It's also because the treatment centers have been so overwhelmed, and the number of cases has proliferated so quickly that people haven't been able to fully conduct contact tracing for people who had been exposed to the virus, or for people who had the virus who could have onward exposed others to it.
Whilst Doctors Without Borders were on the ground helping to contain the virus, emergency talks were held with Margaret Chan, the director of the World Health Organization, and the presidents of Sierra Leone, Guinea and Liberia to see how each country could be supported, as more worldwide support was urgently needed. Other strategies being used in Sierra Leone and Liberia to limit the effects of the virus included closing down parts of the public sector, as well as schools and universities. In recent decades, Liberia, Guinea and Sierra Leone had seen an increase in the literacy rate for 15 to 24-year-olds, the generation most affected by warfare in the 90s. To prevent disruption to students' progress, radio classrooms allow teachers to broadcast their lessons to their students through radio while students stay at home. What the real extent is for students' education in future after Ebola is yet to be seen. Nigeria, the most populous country in the whole of Africa, was the next country on the battlefront against Ebola. A chain of transmission of the virus claimed 8 of the 20 infected. This included a 40-year-old Liberian and US citizen, Patrick Sawyer, who travelled to Lagos, Nigeria in July 2014. He died shortly after arriving at Lagos Airport on the 20th of July. Obi Justin Ejilonu, the nurse who tended to him, passed away 20 days later. Only a few weeks later, on the 12th of August, 36-year-old Mr. Jatu Asihu Abdul Qadir, a member of ECOWAS who travelled with Patrick Sawyer, also died. Nigeria has now been declared Ebola-free and has been seen as a model example for other countries containing Ebola. But Nigeria is an exceptional case. One successful method used to contain the virus in Nigeria was through contact tracing methods, to track people who came into contact with infected passengers travelling to Nigeria. This is in contrast to the spread of Ebola in Sierra Leone, Guinea and Liberia, which was mostly through unsafe burials, contact with the dead and fear of stigma if a loved one had died from Ebola. One major factor as a result of the Ebola outbreak has been the effect on tourism. Clive Bennett, Managing Director of tour operator One and Only Cape Town, said in a statement to IOL, a South African newspaper group,
"We have received a number of cancellations which are directly related to fears over Ebola.
Further action has been taken by some airlines, such as British Airways and Arik Air, suspending flights to Guinea and Sierra Leone from early August. The Sierra Leone Civil Aviation Authority announced all passengers to be screened through Freetown International Airport and go through sanitisation, temperature scans and complete a public health passenger form. Health epidemics can also weaken economies and trade. This has also been the case with Ebola. Agriculture has also suffered, with reports that many farmers are fleeing lands, leaving crops to rot. And in the event of the outbreak, many overseas companies have pulled out their staff members or are in the process of doing so. A good example of this is China Union, which this year recently began to export iron ore from Liberia, but they may have to temporarily close business if the outbreak is not contained. I wanted to find out if any of these events were in fact an exaggeration of the facts on the ground, and invited Obi Sisse, a political and economic researcher, to the studios.
In the specific case of Liberia and Sierra Leone, they are just recovering from very long civil wars that they've had in their country that has decimated their human capital, that has decimated their infrastructure, and that has basically wrecked their economies. They're now in the process of regaining some of the lost growth. So Ebola is quite a significant negative factor to hit them now. The IMF was posting expected growth for Sierra Leone for about 14% this year. Now, the key drivers of the economies of these countries are mining and agriculture. Mining is badly affected. Agriculture is extremely badly affected. Now, if you have these two biggest contributors to GDP slowing down as a result of Ebola, then it's very likely that several percentage points are going to be shaved off their GDP growth for this year. Food insecurity is likely to be significant. We have to point out that the majority of agriculture that's done in these countries is subsistence. It's for people to feed themselves. So you're very likely to have significant food security issues. Never mind the GDP, never mind the agricultural exports. This is just subsistence farming. There's likely to be very significant problems going forward.
The impact on economies of countries such as Sierra Leone will be hard hit in coming months, as Obi Sisse stated, and the issue of food security is most crucial, and more so in the case of areas which have been quarantined. On August the 20th, President Sirleaf of Liberia announced that West Point would be quarantined, containing 70,000 people. This at the time was a controversial decision, given that there were fears that this would be unmanageable, even with military assistance. Violence broke out as people tried to escape, leaving a 15-year-old boy dead, killed by the military's live gun rounds, leaving his family distraught. There's also been an issue of food supplies reaching quarantined areas. Richard Keir, a West Point community activist, explains how this lack of food supplies caused anger at West Point.
When government pronounced the quarantine, there was no preparation. There was no medication, no food, no water, and this place is over 60,000 inhabitants. And these were the things that we were experiencing. And majority of these people comprises of women and children. And so these were the points that were raising. Why would the government quarantine a place without providing the basic social needs for the people, of which majority of them are women and children, and being much vulnerable?
Almost 2 weeks after the incident, another man, the fifth to have escaped Monrovia's Elwa Hospital, which forms part of a quarantine zone, casually strolls through a busy market, allegedly looking for food. An aid worker is seen persuading him to come back to the camp, explaining the importance of this. Uniformed doctors eventually transported him back to the camp. Whilst food security in quarantined areas has been an issue, the World Food Programme have been working towards a more coordinated response.
The World Food Programme has launched a regional emergency operation, which will provide food assistance to around 1.3 million people in the 3 most affected countries: Guinea, Liberia and Sierra Leone. Food is being distributed to people under medical quarantine, people under treatment and their relatives. We are working alongside national governments, the World Health Organization and other partners.
As the death toll extended beyond 2,000, the Sierra Leonean government decided on a nationwide shutdown from the 19th to the 21st of September, confining 6 million people to their homes, whilst health teams checked for sick people. 160 cases were found. But according to a team of scientists from the Swiss Federal Institute of Technology in Zurich, the 3-day shutdown was simply too short to net all the cases in the area. According to research team head Tanja Stadler, the data indicates that the Ebola virus spread consistently throughout June, meaning
whatever public health interventions were performed in Sierra Leone at that time did not help.
I asked Doctors Without Borders how they felt about quarantining methods across the region.
Everyone knows that these borders which get quarantined aren't really truly solid, that there's always going to be movement from one place to another place. Even right now in Sierra Leone, I think it's 5 provinces right now that have been quarantined as well, where there's checks and checkpoints where they take people's temperatures before they're allowed to travel. There will still be people traveling who avoid those roads. And the same thing with the international borders, which have been closed and made more rigid to control movements across borders. It will always happen. It's inevitable. It's just a matter of time. But really the only way that this is going to work is if there's enough areas to offer treatment to really break the transmission of the disease and really stop it.
Accessing Ebola data is virtually impossible due to the risks posed, but there isn't sufficient evidence to suggest that national quarantining is not effective, or was not in the case of Sierra Leone. Whilst casualty numbers were rising in the African continent, the first international fatalities came about from aid workers visiting the region to treat Ebola. From August 2nd to August 21st, there were a series of Ebola scares. 3 Americans, Dr. Kent Brantley, Nancy Wright-Boll and Dr. Rick Sacra, were flown out to receive treatment back in the US. A Spanish priest who left for Liberia also contracted the disease and died on the 12th of August. In the absence of a cure, there were calls from health organisations for experimental drugs to be used to sustain those infected. Cambridge-based biotech company Sarepta Therapeutics developed one such drug and urged federal officials in the United States to consider allowing the unproven drug AVI 7537 to be used on patients infected with Ebola. Enough dosages were available to treat 24 patients within a week and could provide a batch load for another 100 patients within a few months. Barack Obama at the time was reluctant to give a green light for the use of drugs like AVI, urging focus on public health measures instead.
I don't think all the information's in on whether this drug is helpful. What we do know is that the Ebola virus, both currently and in the past, is controllable if you have a strong public health infrastructure in place.
Despite this, the international aid workers from the United States were treated with an untested drug, ZMapp, produced by MAP Biopharmaceutical. Its partners include the US government. It published a statement saying,
ZMapp was first identified as a drug candidate in January 2014 and has not yet been evaluated for safety in humans. As such, very little of the drug is currently available.
Although it makes sense to give drugs to health workers who pose a great risk to exposure, the US government has been criticised on why African health workers had not been given the same untested drug. One such critic, Brian Till, author of the book Conversations with Power, stated,
"The inequality in care couldn't be starker. When a doctor and aid worker from the United States is stricken with a horrific disease, a Gulfstream jet outfitted is arranged to deliver them. But when 2 Liberian nurses working at the same hospital are stricken with the same disease, they are treated with the standard of care that the other affected Africans, those lucky enough to receive any medical attention at all, have been afforded for the past 7 months. Saline infusions and electrolytes to keep them hydrated.
Currently, the Elwa Hospital in Liberia, where these American aid workers were sent to treat Ebola victims, has been closed as the facility ran short on protective clothing, and there are fears it could get much worse for health workers too, if the proper procedures are not put in place.
If you don't have very good isolation and infection control procedures in the hospitals, it's very easy for it to spread, because we do know that it's quite infective once you come into contact with blood, or with if the patient is vomiting or has diarrhea with those kinds of fluids as well. So any break in the mucosal surface of the healthcare worker, or break in the skin, is a potential route of entry for the virus.
But it's not just a case of health workers being affected. Abject fear has and is still continuing to keep some health professionals from working in hospitals with Ebola cases. An example of this is the Donakry Hospital compound in Conakry, which is serving as a centre to treat Ebola cases. According to Abdulaziz Sawane, a merchant living and working on the compound.
People are talking about Ebola all over here. They say if you come here at the hospital, you will get this and that. The public is now afraid of the hospital and nobody is coming.
So in other words, fear of Ebola is helping to keep the numbers up. The UK government decided in October to enhance screening of passengers travelling through to Heathrow and Gatwick airports. But many specialists believe that the UK has the ability to contain the spread of the Ebola virus, should it arrive. Part of that preparation included training of hospital staff and the military in the event of an outbreak, and the infection unit at Royal London Hospital was also put on alert. Clinical vaccine trials have been taking place in the UK as well as Canada and Mali. According to the BBC, drug firms have been under pressure to produce a vaccine. It was the breakthrough and glimmer of hope that many aid workers and health organisations were hoping for. But why did it take it this long to get to this stage, considering that the outbreak began in early 2014?
This is only the 3rd ever public health emergency declared by the WHO. There was avian flu, and I think there was smallpox. The response to those two far outweighs the response to Ebola. I think most people were caught off guard. I think the WHO was caught off guard. I think national governments were caught off guard. And therefore the response has equally been very slow, and it's quite tragic because this is an epidemic and you only have so much time to be able to contain it. The WHO response has been woefully inadequate. They should have been on the ball much quicker, but like I said, they assumed it would be just like previous outbreaks, a couple of months, 20, 30, 40, maximum 100 people die, and then Ebola goes away for another few years. And I think the response was based on that assumption. The national government's response was also terribly slow, but partly you have to understand that they don't have experience of these sorts of epidemics. Also, their health systems are pretty decimated. So the response has been very, very, very slow.
Obisise concluded that the governments needed to have a quicker and more serious response to the Ebola epidemic. Until vaccines are approved from international health sectors, what can we do as individuals to support containing this outbreak?
Encourage Parliament, encourage lawmakers to really attack this and defeat this epidemic before it becomes a greater concern.
Despite efforts to contain Ebola, it may not go away soon. The Centre for Disease Control predicts between 550,000 to 1.4 million West Africans affected by January 2015, the time when the first vaccines for health workers may be available. African governments and the international community are working hand in hand to support rudimentary healthcare systems in Africa struggling to sustain the crisis. more developed countries would be able to contain an outbreak, but the focus is and should be on the countries bearing the full brunt of the disease. Until a vaccine is licensed, the demand for support is critical.